Okay, welcome everybody to this week's call. My name is Jackie Boyle, and as always, I have the utmost pleasure of being able to host this call on behalf of Dr. Joseph Ahrens, dual nominated Nobel Prize scientist, and an extraordinary man with a library of knowledge that we get the ability to be able to access and ask phenomenal questions like today. So it is a great honour to have you in the house, Dr. Ahrens, and I thank you so much. And I will ask you, how are you going today?
Yeah, I'm doing fine. I'm ready to go. I love talking to people about their good health and how to maintain it. I'm here and ready to go.
Cool. So we've got quite a few questions, but at the tail end of it, we are going to try and squash in as much as we can because there's about 8 questions here today. But we are going to look at even looking at dosages along the line there too, and why it's okay to change your doses on what you take and so forth. But our first question, Dr. Ahrens, is looking at a young child using emulin C for children 7 years and up. Is it suitable for children to use, and what dose per day?
Well, it's suitable for all children to have as soon as they get on the solid food, whether they're 7 year or older or less. Get on solid food. You can start giving them emulin because it's made out of food. Actually, this is what should be in everyone's diet, and their mothers had it. The baby, and I propose that also. Mothers, nursing mothers, they should be on emulin, and they'll pass them that emulin on to their infants. And everyone needs it. It's just like saying, should an infant have vitamin C? Well, if they do, they need vitamin C, but they should probably be getting it adequately through their mother. And if she's not, well, she should be on the product. But as far as getting on solid foods, that's really the key right there. And how much should you give a child? Well, a minimum dosage, basically, for our U.S. audience, it's off the top of my head, 3 capsules for 200 pounds. So 1 capsule per 100 pounds. So actually, if you've got a child that's down to 10 pounds, 20 pounds, then they should be having like 1/10 or a quarter of a capsule. So how are you going to manage that? Well, in the case of my own granddaughter, her mother just mixes it up in whatever she's drinking that day. She'll make up some natural fruit juice, and she'll just go ahead and put that in that juice cup. And when she asks for juice, and by the end of the day, she's getting a full dose. She also will take some of that, sometimes the emulin, and break it into her oatmeal or whatever she happens to be eating. And I tell you, that granddaughter knows it. Even when I'm keeping her, babysitting her, I'll forget to put in the emulin, and she'll say, "Hey, don't forget the emulin." So it has a little bit of a peppery flavor for those that have tasted it, a kind of common intermediate flavor between cumin and aspirin, kind of a biting little flavor. It's not unpleasant. Actually, I'll go ahead and put it right on top of my eggs if I'm eating eggs. It's a good flavor that way. So just know that it's not sweet, but 1/10 of a capsule, 25% of a capsule, they won't even notice it. So just throw it into their juice or sprinkle it on whatever they're eating for breakfast. Yes, it's safe, and just use that dosage. And you can figure out your child's own weight. 1 capsule per 100 pounds. So, that's around 40 kilos. 1 capsule for 100 pounds or 40 kilos, and just divide it down.
Okay, excellent. Also, is there green tea and emulin? And second question for the same person, is it something that affects the body's estrogen levels?
The emulin M can affect the testosterone and estrogen levels slightly. There is some evidence, but it's minuscule. So I'll tell you that emulin C will not, has not, never has. Emulin M can raise estrogen and testosterone levels ever so slightly.
And the green tea?
There is no green tea in this product. We're actually using, sometimes we do extract out of green tea, but we're looking for chlorogenic acid, not caffeine. And we currently get the chlorogenic acid out of green unroasted coffee beans. We're extracting the chlorogenic acid, which is a starch blocker. You can get chlorogenic acid out of green tea, but most of the people use green tea for the ECCGs. So that's a strong antioxidant. We don't do that. We're not into. We could have, but we decided we wanted to focus on chlorogenic acid. The three components of emulin, whether it's C or M, is myricetin, chlorogenic acid, and quercetin. And quercetin is the one that can raise testosterone and estrogen levels. And in the C, it's an extremely small amount of it. Like we're down to like 1%. And the M is a lot higher. It's around 20%. So if you're concerned about that, don't use the M. The C is just fine.
Okay, thank you. There's a lady that's got a daughter who has IBS, and she started taking 4 capsules of emulin M and increased to 6, sometimes 8 when the pain worsens. And during the first 2 months, she observed that the pain was becoming less, but on the 3rd month, the pain became intolerable again. And they're just asking in regards to this, is this part of the healing process that this is going to happen with IBS, or should they be considering taking emulin C instead?
Well, that's a very interesting question because I myself at one time had Crohn's disease and I got completely eliminated because of emulin. Crohn's and IBS, irritated bowel syndrome, Crohn's disease, they are all tightly related. The only real difference between them is whether the irritated part of the colon and guts are on the surface or they make little, but the cause is the same. It's an autoimmune disease, just psoriasis, and your body is attacking itself. And the lining of the gut is extremely sensitive. It's where we're absorbing all of this material, and it got out of whack. And because your immune system was unregulated, and it started devouring itself. So what happens is there's an irritant in your bowel, in your colon. And that irritant, your body says, well, what's going on? There's some irritant here. And they send out the troops to destroy the irritant. And if they're not directed properly, they actually end up attacking the lining of the gut itself. So they're soldiers. They're wanting to fight. And the general's not there. He's gone. So they end up turning on themselves. It's the same story with psoriasis. Now, whether somebody gets IBS or psoriasis or another autoimmune disease like rheumatoid arthritis, that's your DNA. That's what makes us different, whether you're more sensitive and you'll go down one path or another. But the underlying cause is identical. It's about regulation of your immune system. And that's what emulin does. So it's a little complicated story for a couple of reasons. First of all, that's why you do clinical studies. You just don't know in one individual, was there any change? I don't know the blood chemistry. I can't be anybody's physician, by the way. This is not medical advice. I'm just describing it as a physiologist. I'm a doctor of physiology, and I have to talk in very general, specific terms here. It cannot be your physician, but your body will go in cycles of what it does like or doesn't like, even with some foods. As all of you know, sometimes you'll eat a certain food, you're fine, and all of a sudden next week or month, it just turns against you. And you say, wow, I've eaten that all my life and now there's trouble. Well, your body is like that, especially if your immune system is not regulated. It just gets a little confused. So here's what you should do. First of all, if you have any symptoms that changes, like you didn't have any pain and then now you have pain, you need to quit everything if you can, especially quit emulin. Just stop. Wait a week because it will stay in your body for a week. The half-life is 4 days. So that means in 8 days, it's 25% in your blood. So if it's 100% on day 1 and you cut out, it will take 4 days for it to be 50% in your blood, and then another 4 days to be 25%. So cut out emulin for a week and then add 1 capsule. Go a week, You're okay? Add another capsule. Go and you whatever dose you would like to be at. I would say 2, 3, or 4. And if it comes back, I've got some good news and bad news. One of the things is you could cut back again and try again. I think even in your own self, it took you a while to get used to the emulin in your body, but once you got past that and figured it out, it had phenomenal results. Let your body get used to it. Look, this is a food product. These are just like vitamins that should be in your diet. And if you introduce a new food into your body, it's going to first say, well, what is this? All foods are not good for all people. And if you change your diet, you can have a lot of discomfort and distress just by changing your food. That comes from the bacteria inside your gut are readjusting to that new climate. That's really what's going on. You say, I got the gut. It's usually the change in the bacteria trying to get used to the new food. So emulin is a new food. You've not had that in your body, and even if you've gone a couple of months, your body could still say, "Wait a second, we weren't paying attention. Now let's try to attack this," and just do what I said. Go back, stop, flush out. 1 week, no emulin. Then add 1 capsule. Go for a week. How am I doing? If you're okay, add another one, and etc. Now, as I said, the bad news is, hey, you know what? Some people could have a reaction to this, like any food. Some people can't stand bell peppers. Some people can't take onions. Some people can't take beef protein. Everyone is a little different. So it might be that you are sensitive to emulin, or the daughter is sensitive to the emulin. I doubt it, because we have had some really confirmed cases of that, but it's been like only 5 people out of, as you know by now, hundreds of thousands of people using this product. Do you think that addressed that?
I do, and I do, and I think that personally, like with IBS, sometimes when you do eat food, Dr. Ahrens, it would be right to say that processing the food itself, sometimes if you've got a sensitive gut, that it can create discomfort. So, and depending on if it's new food, or if it's more food that you normally would have, or if you're not feeling 100%, that can change how the body responds. So yes, I do. This is a very short question, and I'm sure you can say just yes or no to this one. A lady has a daughter who's 5 months pregnant, and she's considered to have gestational diabetes. And should she be taking emulin C?
Yeah, emulin C, no issue whatsoever. There's no contraindications whatsoever. It will help regulate her blood sugar regardless. But I want to get back to saying that we're not attacking diabetes here. Your body is taking things in emulin that it needs, and it's your body that will adjust itself. Yes, emulin C.
Okay. This is an interesting one. I haven't had it before, but anyway, it's about product. The product's been mailed to someone, and it's been sitting in their mailbox for 2 weeks. She's an elderly lady. She wasn't aware that the product was sitting there for one reason or another. But because it's been sitting in the sun for 2 weeks in a mailbox, will this compromise the product since it's been in the heat for so long? Like, what would your suggestions be there?
If it got too hot, yes, it could compromise it. That's usually around 140 degrees Fahrenheit, 35 to 40 degrees Celsius. It can denature, but that's not, I don't expect that at all. It can possibly be in some circumstances, but when we chose the components of emulin, we actually chose those that you could actually bake in an oven. So in normal circumstances, you can go up to nearly 200 degrees Celsius, 400 degrees Fahrenheit. Put them in cookies if you want to do that. So no, I don't think there'll be any problem. Yes, under certain weird circumstances of temperature and fluctuating up and down, and then freezing it, then really hot, you could do it. But I don't see any issue at all with it having just in a mailbox.
Okay, great. Thank you. So somebody that's on dialysis and, they're looking to get assistance with pain and they're suffering with constipation and they're not wanting to have, it's been suggested to them that they potentially are going to have a colostomy bag put on there. They're just wondering whether emulin would be suitable to be able to assist and support this person with dialysis and with their symptoms of pain and their constipation, as to whether that's going to be of any assistance for their body.
Well, regardless of the dialysis in the future, having to have a bag, I'm really sorry about that. It's horrible. I've known people, friends, relatives in that situation. Regardless of that stuff, your body, in order for it to heal itself and do the best it can, needs to be in its best condition. So it's just like asking me if I have vitamin C or vitamin D, will it help me? Of course it was. You need to have a certain level of every vitamin that has been identified. You have to have that in your diet for it to perform well. So that's what we say: eat dark leafy green vegetables, etc., because they have most of these vitamins. Make sure you have enough iron, etc. And I'm saying to you, make sure you have enough emulin. Those miracetin, chlorogenic acid, and quercetin, you need them in your body as your body is going through this drastic problem here. It needs to be the best it can. So it's like me saying, well, if I cut my foot off, would that hurt my lung cancer? Yeah, of course it will. Your body needs to be in good condition in order for it to address its issues. And that's really what we are doing. We're not healing anything self directly. We're not curing any diseases. We're letting your body be where it should be for it to take care of itself. And that's why it appears that emulin is such a miracle, because, oh, I had psoriasis, it's gone away. And I had arthritis, it's gone away. But it wasn't the emulin. Your emulin just manages your immune system, your healing system. And now it's able to take care of that. Now, there's specific evidence that some of these compounds do help some of those specific issues. But our message here is get your body in good shape and, be the correct weight. If you can, do whatever exercise you need to do. Get the right amount of sleep. Have emulin. All of those will help you in that situation. And, emulin, and it's emulin M, unless you're concerned about elevated blood sugar, then it's emulin C.
Okay, no, that's great. Thank you. Uh, we've got a question in regards to somebody that suffers with multiple sclerosis, and so that's one, what would be recommended for a person with multiple sclerosis, but also what would be best recommended for a heavy metal detox? So there's two questions there.
Well, we get right back to actually the answer to the previous question was that you need to get emulin in your body so it can deal with these issues. It can help get cleansed. You can take one of the other cleansers that Valensis has, for instance. If you need to do that, that's excellent. Emulin has no specific impact on the heavy metals themselves. It's not a heavy metal remover. However, it's your body that ultimately removes those heavy metals itself. And we are and the cleansers just help that flow better and flush those out. But also emulin, you need emulin there just like you need any other vitamin, so that your body will do the job it meant to do. Your body will get rid of those heavy metals. Cleansers help it do it a little more easily, but if you have emulin, it'll do it as it was originally designed. So whether it's heavy metals or any other issue you're dealing with, you need to get emulin. If I had patients as a medical doctor, everybody that walked in my office, I just give them emulin. That's the first thing I would do. Then we'll see what's really going on. I mean, I don't understand why that's not the rule everywhere. Don't say, well, I think this will help. You got high blood sugar, you got, high blood pressure. Let's try you on emulin. No, everybody needs emulin. It's just like a doctor ought to first look at the diet before doing anything else. Let's look at your diet. Let's do a blood test and see what are the levels of vitamins in your blood. How is your liver functioning before addressing even having a broken bone? That's what I would do. So I'm telling this person, yes, get on emulin. No matter what the outcome, it's going to be the best outcome if you're on emulin.
And for multiple sclerosis?
You know, similarly, there's a lot of neurological issues, Parkinson's, Huntington's, people with attention deficit disorders. On emulin, they have shown remarkable improvement. And it's not, again, because of the emulin doing something to the nerve tissues. It's about your body being now in its best healing condition and operating condition, and it itself can actually re-insulate your nerve, re-insulate the wires. I've seen people with Parkinson's get on emulin and great improvement. Well, it didn't send in new wire insulation. You know, that's the sheath on top of the nerve. It actually got your body in shape, and your body healed itself and got the nerves in good condition. And also firing across the synapses, which is the main problem in those diseases. It now fires smoother and regularly because your body's immune system is now operating properly and healing where it should heal and not overhealing in other instances.
So Dr. Ahrens, would you put fibromyalgia into that not category, I guess, but would you, for people, because somebody has actually asked in the chat that they've got people that are suffering with fibromyalgia, would that be a similar response to those people too?
Yeah, it'd be exactly the same response. Fibromyalgia is a debilitating disease, but it's very, very strange. I think you might know people yourself that have had emulin and they've done remarkably better. You know, even neuropathy, it's not a miracle cure, but if you take emulin, it'd be better than it would have been. And I wish that, you know, one day we might be able to come up with something that knocks that stuff completely out. It controls all those nerve issues. But right now, look, get your body as good as it can be, no matter what type of neurological issue you have, even Alzheimer's. It'll improve that because it improves the sugar metabolism in your brain, and therefore your body then functions properly. And people say, wow, you know, I took the emulin and I have less Alzheimer's or what? No, we didn't cure Alzheimer's. Your brain just started having proper metabolism. The immune system started operating properly. And then you have less buildup of plaque in your brain, and the symptoms of Alzheimer's reduce. So we are not curing any diseases. We're just getting the body the vitamins that it needs to perform properly.
Okay. I'm just going to share my screen here, Dr. Ahrens, because I wanted people to see what we're talking about with this particular question here. And in regards to, we're looking at psoriasis, and you know, this person's been taking emulin since September 2020, adjusted the treatment, as we can all read this, so it would be more effective. Been taking 8 tablets a day, reducing it down to 6. And just looking at basically the condition since then, since they've reduced it, it had worsened, and sad because they feel as though they haven't seen improvement. And they're just looking at 1 year on. Are they just wondering what have they done wrong in regards to what doses that they've decided to take? And then it's come down to a financial situation for them. But initially it has created improvement by the looks of it, and then now it looks like they're questioning as to whether is he going to need to be taking 8 capsules per day for the rest of his life to be able to manage this particular case with psoriasis. Well, the symptoms, I should say, rather, sorry.
Yeah, you know, psoriasis is tough because you see this on the skin, but psoriasis can be inside you too, on your organs. You can have that same stuff going on inside you. It's absolutely very similar to rheumatoid arthritis, very similar, in that your body is attacking itself. Here it's attacking the skin. You get several stages of psoriasis, plaque psoriasis, which is a pretty bad case here. However, about the dose, and we ought to talk about these doses. Everybody is a little different in how they are affected or how their body absorbs nutrients out of your diet. Let us look at something just like caffeine. You know, my own mother can drink 10 cups of coffee in the afternoon and 2 or 3 right before bed, and she is unfazed. Her body does not absorb caffeine well. And on the other hand, myself, her own son, I mean, I have to, one in the morning, I don't want any more caffeine. I mean, I'll be a jitterbug. I absorb caffeine very easily. So when we talk about, okay, a 200-pound person needs 2 to 3 capsules a day, we had to work that out on an average. I don't want to say, okay, some of you are going to have to take 20 capsules. I mean, it's really possible. I hope not. But if you have a problem going on in your life like this, you can see absolutely this is a case of your immune system is whacked out of control. I can see right away the tumor necrosis factor alpha is in there telling those cells, all those little soldiers, to destroy everything in sight, you know, slash and burn, and it's attacking its own body, your own body. And in that case, certainly they need more than a couple. The couple is just a maintenance dose. I never have myself taken over 6 capsules a day. I take 2. I probably could get by on 1. I've had medical doctors call me up and say, hey, I don't know why you recommended 2. I get a perfect result, which is taking 1 capsule a day. Good for you, but there's somebody down the street there that needs 10. It's because they don't absorb it well. We are working on as you know, Jackie, a product that has an additional nutrient in it that should be absorbed more easily. We're working on that. Right now, we've got the emulin M&C, and some people do not have good bioavailability. It's very low. So we saturate the body, hoping that some of it will get into your tissues enough. You never do have a danger more than what you need, because if you do, you can't overdose. If your body will use what it can, it'll absorb what it can, it will use what it can, and then over that you'll eliminate it through the urinary tract, or it'll migrate to your skin through the sweat pores. There's no danger of overdosing. You know, emulin is an expensive product. There's just no way around it. It's not, a lot of products, especially sold through MLM, are relatively inexpensive, and you can get a lot more of them. We cut the dosage down. We've changed the capsule size and cut the dosage down to try to just get the bottle available to people that could just needed a maintenance dose. You know, that so they weren't having to buy more than they needed. I could make the capsules bigger and double the dose and say right on the bottle, take 4 a day. Well, that would be overkill for a lot of people. But even then, some people would need to have 4, 8, 10 capsules a day. And it's all about your body. What does it need? Let's look at somebody who's exercising. Their body is being demanded upon them to repair muscle and make new muscle. Everything is and their oxide shows are whole lot because of this. We do that on a little bit, and your body sends in more amino acids to make more protein. So if you're under that type of stress, you need a lot more protein. If you go into the times that you have colds or flu, you need a whole lot more antioxidant vitamins, such as vitamin C. Vitamin C, you know, it was discovered vitamin C that helped all the little capillaries and particularly in your mouth. And the English found out that if they didn't have enough vitamin C, your teeth would fall out, because all the blood veins in your gums would deteriorate. That's what really was going on. And that's what vitamin C's #1 job is in our body. But it has a tremendous amount of other functions, such as being a strong antioxidant and supporting your immune system. I think everybody therefore on this call knows that people say, hey, vitamin C for a cold. I mean, it's not an old wives' tale. Vitamin C for a cold, and it's true. Support your immune system. If you're getting cold or flu, you need to take more vitamin C. You need to increase the zinc in your diet, because now you're under a different challenge. So if you're under something like like psoriasis, your body is tremendously challenged. You need a whole lot more emulin than somebody that is in relatively good health and doesn't have these autoimmune issues. Not to attack the psoriasis itself, but your immune system is under attack. It needs a lot more raw materials. It needs a whole lot more than emulin. There's a whole lot of other products you need. So eat a very good diet. Exercise when you can, because that doesn't just build your muscle. It does a whole lot of things in your body, including the oxidative exchange in the capillaries in your lungs, and getting rid of the debris in your body. So you're going to need more of that. So I just have to tell you that, yes, you may not have to do it all your life. No, you may not. Get the immune system under control and then think about cutting back. I mean, as I say, it is expensive. You may have to take 8 to 10 a day. As you saw, you had some previous control. You dropped down to 6 and saw not as much control. My late wife had a thing. She, for years, said emulin is just a bunch of junk. She never got any benefit of it at all. And so I talked her into going up to 6 to 8 capsules a day. And she remarkably got better from several things, especially like arthritis. And it was because she is very resistant to the absorption of emulin in her body. But she got over that barrier, and she said, I can't live without it now. You know, that's what people tell me everywhere. I can't live without it. I'm no longer on these drugs. I can't live without it. But no, it's not a sign that you have to have that high of a level the rest of your life. Get yourself under control. Commit to whatever it is, 3 to 4 months. Get yourself under control, and then slowly start cutting back.
So I think, Dr. Ahrens, thank you for that, because I think it's very important for people to understand, because there's lots of questions that come through all the time that, should I be taking more of it? I've got the symptoms of XYZ, what may it be? And even so I can stay compliant, it isn't all about me, but even for the last week, my health's been compromised. I spoke to Dr. Ahrens about it. I take a lot because of my symptoms that I'm dealing with, and it manages my symptoms very efficiently, thankfully, from where I was at 5 years ago or a bit over. But I actually I took 8 extra a day, and I'm on day 2 of taking 8 extra a day. But even from when I started, from when my health deteriorated from what I was dealing with, overnight, I was a different person. Like, I still had symptoms, but by goodness, by taking those 8 extra a day has made a huge difference. So that I'm going to cut that back, just as what Dr. Ahrens said. And this is why we brought this topic up, because there's a lot of people ask this question, like it's not working. It is actually working. There may be something that's changed in your body. There may be something that your body is under attack from, some sort of external thing that's happening. You may have changed your diet. You may have extra stress things that are happening in your system. So your body is combated and it's asking for extra help. So it doesn't hurt to actually load up, have more, get what you need, get on top of whatever's happening with your body, and then reduce it back again. And I know I'm going to do that. And that's why we did bring up this topic, that it's okay to do that, because you'll be really surprised at how much of a difference that it makes even within that 12-hour period by doing that. When we look at expense, how much is the cost of good health? Invest time in your health before your health invests all of your time. And I say that with a lot of passion, and I have nothing but, I will stand on the top of a mountain for you, Dr. Ahrens, for what you've given to us globally, because it's just been a gift to people's health. So is there anything, I want to thank you so much for today, because you've really answered a lot of questions for us. And I really thank you for your time, because I know that you're really, really busy. Is there anything you'd like to finish off with today before we go?
Well, I do want to remind people that if they can possibly scrape the money up, and I don't want to tell anybody go in debt, but even use a credit card. If you do order a lot of the product, it does drop dramatically, almost in half. I am not involved in the retail, the MLM side of that business. It's totally different from what I understand. You might correct me on this. $59 retail, it can drop down into something in the 30s. if you can order enough at one time. So look at your requirements for the year and just order a lot. At least one bottle at a time. Yeah, that's really expensive. And, you know, even we here run out. I have no way to get it. And I have to call up Dave Jordan and beg him to send me some emulin because we don't manufacture it ourselves. So, and everybody, it's important. And I got a few bottles in the house, and it was like a damn fight here about who's going to get these emulin. So I understand that people need it. You know, they call me and say, look, I can't live without it. My hip is paining me as soon as I ran out 6 weeks ago, and I'm doing the best I can on that. You know, my parting words are, like you said, health is so important. I would, if I knew what was going to help my health, I'd eliminate anything else I did. You know, I would eliminate one activity, whatever it is, to get that extra $50 or what you need a month. And I wish everybody good health. This is why I'm in this business. I'm a physiologist, and that means I study the chemistry of life. And this is a fascinating topic and people here that are in the MLM business. I know some people on the call, most of them are probably in the business trying to sell the product, but there's other people that are here just because they want information. Everybody needs emulin. It's not a joke. It's not a byline that I'm trying to sell more product. If I was an MD, people walked into my office, I'd look at their diet and I'd tell them to take emulin and come back and see me in a couple of weeks before I did anything. It's like a car. You know, my car blew up today. You go in there and the first thing they do is say, well, let's clean it up and get it in condition here before you start tackling about the individual components broken. And I said, yes, a good idea. Put emulin in the gas tank. So I wish everybody good health. That's my parting words.
Thank you, Dr. Ahrens. And just for everybody that's on this call, just to let you know that we're not aiming to cure, heal, and or fix anything here. It's really just asking questions. We're looking at symptoms that have been presented to us today, and it's up to you to seek medical advice where need be. I have put in the chat line again that the best information that you can possibly get that you want to share with people is at www.drjosephahrens.com. There is so much information in that website. It should be able to answer everything for you, other than to please send in your questions to Dr. Ahrens' email, and we will get back to them on a monthly basis. So I want to thank everybody on behalf of Dr. Ahrens and myself for actually giving up your time and joining us on this call. And for those of you that share this with others, or for those that watch it later on, we thank you so much, because without you and without your support, we would not be sharing this throughout the world. So thank you so much, Dr. Ahrens, and thank you everybody for being on the call today. Have a great evening.
Thank you. Thank you very much for being here.
Thank you. Thank you.